Welcome. This is Dr. Aslam. Let us see the pharmacology MCQ number 2 for entrance examinations, including but not limited to United States Medical Licensing Examination Step 1, United Kingdom Medical Licensing Assessment, Saudi Commission for Health Specialties, FMGE, Foreign Medical Graduate Examinations, NEET-PG, GPAT, FCPS, NAPLEX, NCLEX, and entrance examinations in medicine, pharmacy, and nursing. Let us see the case. Yes, this image represents our today clinical case. You see in the mountain and trekking. Let us see the case. The STEAM, a 20-year-old female software engineer, decide to go on a trekking expedition to the Himalayas with her friends. They quickly ascend to an altitude of 3,200 meters above sea level over the course of single day. Within 24 hours, she begins to experience headache, fatigue, dizziness, nausea, shortness of breath on exertion, and difficulty sleeping. Physical examination reveals mild facial puffiness and no signs of fever or infection. The question is, which of the following medication is most appropriate to manage her condition? There are 5 distractors. The first one is a mannitol, which is osmotic diuretic. Next is furosemide, which is loop diuretic. Third one is acetazolamide, which is carbonic anhydrase inhibitor, diuretic. Fifth one is spironolactone. Fourth one is spironolactone, which is potassium sparing diuretic. And the last one, fifth one is hydrochlorothiazide, which is thiazide diuretics. So here, all the distractors are diuretics. The symptoms. If we see the symptoms, headache, fatigue, dizziness, nausea, shortness of breath on exertion, difficulty sleeping, and mild facial puffiness. There is no fever, no infection. So if we find the diagnosis by symptoms, it's easy to answer the case. Which of the following medications is most appropriate to manage her condition? All the medications or all the distractors are diuretics. And the correct answer of this case is acetazolamide, which is carbonic anhydrase inhibitor. Let us see the explanation. First, to explain or to get the answer, we need to know what is the diagnosis. And the diagnosis we can find out by the symptoms. What are the symptoms? Headache, fatigue, dizziness, nausea, shortness of breath on exertion, difficulty sleeping, and mild facial puffiness. These all symptoms are of alkalosis. Now, if the question is that if there is a alkalosis, why need to give the diuretic? And this alkalosis is occurs when the patient or the person is on high altitude, and the diagnosis is acute mountain sickness, AMS. When the person is on high altitude, it causes alkalosis, and due to alkalosis, increase in the bicarbonate ions, there are the symptoms. Now the question is, why diuretics are used to treat alkalosis? Let us see. To counteract the metabolic or respiratory alkalosis, these all symptoms are of alkalosis. We need a drug that has mild metabolic acidosis. And acetazolamide has the side effect of mild metabolic acidosis. So we are using the diuretic acetazolamide for its side effect. And the side effect of acetazolamide is mild metabolic acidosis. Now, if you see the first three names of acetazolamide, ACE, it indicates the acidosis, ACE, acidosis. What is the mechanism of action of acetazolamide? It inhibits carbonic anhydrase inhibitor, the enzyme which is responsible for the carbonic anhydrase ions, and leads to increased bicarbonate excretion in the urine. And this bicarbonate is increased in the alkalosis, and the alkalosis cause the symptoms in this patient. If the bicarbonate excretion in the urine, it causes loss of alkaline ion and resulting in mild metabolic acidosis. So here we are neutralizing alkalosis by giving mild acidosis drug. This is the mechanism of action. Acetazolamide acts in the proximal tubules of the nephron, inhibits the hydrogen ion secretion and bicarbonate reabsorption. If the bicarbonate ion reabsorption is inhibited, it causes loss of alkaline ions, resulting in mild metabolic acidosis. Now, what is the summary of this case? We are using mild diuretic action of acetazolamide. And due to mild diuretic activity of acetazolamide, it decreases the cerebral edema and relieves the headache and nausea in the patient. The bicarbonate loss results in the mild acidosis and increase the ventilation, and it will take care of symptoms of the patient, that is shortness of breath or exertion. Acetazolamide will increase the respiratory drive, and it will increase the oxygen availability, and it will resolve the issue of sleep. The dose of acetazolamide for prevention purpose, if anyone planning to go for trekking, he should take 125 milligram orally twice daily. And for the treatment, 250 milligram orally twice daily. So acute mountain sickness, the drug of choice is acetazolamide. And if the patient with severe mountain sickness and intolerance to the acetazolamide, the second drug you can give dexamethasone steroid. Thank you very much. See you in the next pharmacology MCQs.